to Dr. Morné of Cottage Vet about elbow dysplasia. Dr. De Vet, most pet owners I think have probably heard of hip dysplasia, but can you tell us a bit more about this condition known as elbow dysplasia?
Certainly. So elbow dysplasia is basically, in a nutshell, when we look at the elbow of a dog and there is actually a malformation or a mismatch between the bones of the elbow. Now, what's very interesting about the elbow is that it is composed of 3 different bones. Now, these 3 different bones each develop independently, and they eventually have to come together and form a joint with all sorts of other little pieces coming together as well. And if there's something that's not right, mainly the length of the radius, which is this bone, and the length of the ulna, which is that bone, if they don't match well, we find that the whole elbow isn't as nicely locked in as it should be. So there's a bit of movement in the elbow, a bit of looseness where it shouldn't be, and that is what basically leads to elbow dysplasia.
So what are the most common symptoms? As a pet owner, how would you know if your dog had elbow dysplasia?
So the most common thing we see is limping. So most dogs would start, and they can start very young. They can start at about 7-8 months already with a slight limp. It's not usually a dramatic, I don't want to put my foot on the floor limp, but it can be you can see that there's a limp. Some dogs, it can be extremely subtle, especially if both front legs are affected. And often you won't even know that they've got elbow dysplasia because they adapt to walking quite sort of stiffly. And you would actually just see them more walking stiffly than actually limping on the leg.
Are some breeds at higher risk than others?
So the classical breeds we see this in is our large breed dogs. So we're looking at German Shepherd dogs, so we used to call them Alsatians, so German Shepherd dogs, Rottweilers, Labrador Retrievers, Golden Retrievers, and then we do sometimes find it in smaller dogs as well, but it's normally more a large dog problem.
If I bring my dog into you and you suspect that it has elbow dysplasia, what do you look for? How do you diagnose?
Okay, so firstly we look and we would assume that there would be some sort of limping or there would be some sort of stiffness in the front legs. And remember, you might not see the symptoms only at 6 or 8 months. We might only start seeing symptoms at 6 years old. That can also happen. But the bottom line is somewhere along the line we're going to know that the front leg is somehow sore. There's something not right. And then by careful moving of the joints on the front leg, starting normally down below, moving up to the shoulder and the neck, we can sort of localize or zoom in to know that the pain that we feel is coming from the elbow. And most dogs would not like it if that elbow is flexed. So if we take it up to the body, they won't like it, they would be uncomfortable. And then one of the specific conditions we can actually also see is if we move the leg inward and push it up, they can also be a bit sore. And all of those things can point to the elbow as the problem. But the only way to actually make the diagnosis is to take some x-rays. Because on x-rays, we can evaluate what the elbow actually looks like. Is the radius on the ulna actually the length that they should be? Is there arthritis starting in the elbow itself? And we look particularly at the way that all of these bones fit together, and they should fit together like a puzzle. And if they're not fitting together like a puzzle, that would alert us to the fact that there is potentially elbow dysplasia.
What is the treatment for this condition?
So the treatment can vary quite dramatically depending on what the actual problem is. And I say that because elbow dysplasia is actually quite an umbrella term for sort of subclassified, more specific conditions. And each of those conditions that we find has its own treatments that we can look at. For instance, we have this little bone here at the back might be loose or hasn't ever become part of the bone, that's got a different treatment to this little point over here causing a problem. So there are specific, almost like sub-classifications that we look at, and each of those things has their own sort of treatment that we look
I'm
for.
assuming you're talking both surgery and medication.
Yes, yes. So medication is always a place where we start, because we find the majority of dogs actually do extremely well just with medication. Only in really pronounced deformities of the elbow is surgery often advised. And that often goes together with long-term management as well. And I think it's very important. Just giving medication or just advising surgery isn't the end of the treatment. We have to look at things like activity, at body condition, physiotherapy. All of that comes into play when treating elbow dysplasia. This, unfortunately, is not a quick fix condition. This is a condition that is normally there for the rest of their lives, and the better we treat the whole patient, not just the joint, the better chance we have for them to have a good quality and quantity of life.
As a pet owner, is there a way that I can help my pet avoid this disease? Are there preventative measures?
So the biggest thing that we need to do to prevent elbow dysplasia is firstly to get dogs from a reputable breeder. Some breeds have this as genetic, what we call genetic predispositions, and you actually have to screen breeding dogs to know whether they might pass on the genes. So it's good to check with the breeders whether the mom and the dad might be carriers or might have elbow dysplasia themselves. Secondly is, if you are not sure, if you've got a dog and you don't know where they come from, the biggest thing that you can do is to feed a good quality, super premium dog food that's aimed specifically at large breed dogs. Remember, this is a developmental problem. They develop abnormally. And the large breed dog foods are there specifically for that reason. In a nutshell, they actually slow down growth. So we want them to grow slower so that the bones can keep up. Otherwise, they just grow too quickly. The bones can't catch up to the body's growth, and we get worsening of the actual deformations. So a large breed puppy food is by far the best thing you can possibly do for your large breed dog.
If I'm looking for a food, the right food for my dog, what would you advise? Can I go to the supermarket and pick something off the shelf by reading the label, or should I rather come and see my vet with my dog?
I would really advise rather go get some advice from the vet, and there's specific reasons for that. To formulate large breed puppy dog foods is actually very tricky, because some of the very specific things that enhance the growth of dogs need to be controlled, and to balance that all out is very tricky. So there's a lot of research and a lot of fine balancing that is needed to actually get a proper, well-balanced diet that actually works. And one doesn't just want a diet based on a philosophy. You want a diet that's based on science, and that's based on the scientific principles to slow their growth but not stop their growth, to slow their growth and get them to skeletal maturity just at a later age, because in that way the joint just has longer time to grow and form much better.
Thank you very much, Dr. De Wet. That was very helpful.